So my name is Natalie Sampson, and I'm here at U of M-Dearborn. I'm a professor in public health, and I'm presenting on behalf of a project with my colleague, Carmel Price, who's also here as sociologist and a team of undergrad students. So I was thinking this morning it was quite appropriate that it was a rainy morning because I'm going to be talking to you all about flooding in our great region here. And so as one of the most pressing issues of our time, climate change is upon us. We often think about sea level rise, levees breaking, how this affects sea level across the country, right, at these coastal regions. But today I'm going to bring us back to our lovely pocket of the world in the Midwest, right, in Michigan here. And I want to talk about flooding that most people don't pick up on in the media. So recurrent flooding that's happening in basements of people all over the city of Detroit that's exposing them to sewage and mold and all sorts of trauma. So August 2014, some of you might remember this event. I do. It was my first day on campus here as an assistant professor, and I remember driving down M39 and immediately turning my car and driving right back up the on-ramp because that's what I saw. And so thinking about these issues combined with projections for increased precipitation for our region and an aging infrastructure, Dr. Price and I have been really intrigued with trying to figure out how is this affecting vulnerable populations, right? So many of you might know that we have a combined sewage system here. It's lovely. I hope you already ate your breakfast. What happens is that wastewater, when we have too much stormwater, makes its way into our rivers, which makes its way into our municipal drinking system, right? So I want to share with you some of the narratives of Detroiters who've been dealing with this issue. And so I have a clip here from a documentary that I helped create with Detroiters working for environmental justice and a local filmmaker. I just want you to listen to this story.
It's like every time it rains, I be thinking, oh man, is my basement gonna flood?
Everybody's afraid. Every time it rains, we're all in a panic.
It's a lot of stress. Every time it rains, it's stress. This is what I had to wake up to. Look at all this. Something got to be done about this. So I got to look for my basement flooding every time it rained. I don't think so. This is what I have to go through. You see the water level? See it on the wall that I'm pointing to? Right along there. This is what we got to deal with. I lost a lot of things that couldn't be replaced. And so I started building things up again. And then we had another backup last year, as I said before. And I lost all of it again. And this time, the sanitizing company came out and they cut my panel because I have a finished basement. I had a finished basement. And they cut it like 2 feet up from the floor. It rains heavily. You know, it seems like every year it's getting worse and worse and worse. Because like I said, we didn't have floods.
And so we quickly realized this wasn't a unique story, and it wasn't a story that was just tied to that August 11, 2014 event. In fact, people all over the city were starting to tell us their stories as we did work around some of these issues. And so we thought by interviewing people and collecting these narratives, we could show the scale of this issue to decision makers. We thought we'd probably be hanging out in the Jeff Chalmers neighborhood where we know it's a high-risk area, but quickly, we didn't put it on here, but across this map, we were hearing these stories. So all across the city, people had been experiencing this. And so we worked with a team of undergrad students to start to cull through these 20 interviews, and there's more stories coming our way every day. And so we've learned a few things so far, but there's a lot more work to do with analysis. Many people are really traumatized by this experience, right? It becomes a chronic exposure, so it happens time and time again, and their children are exposed to black mold that remains in the basement. So we heard a lot of these really concerning quotes about seniors cleaning up the basements on their own because they couldn't access funds to do so, or children playing outside in puddles that look like rain puddles with their rain boots on, but actually playing in sewage. Displacement, constant displacement every time it rains, so that you lose your social networks, right? So we think there's a lot here, and as you can see, these stories are scattered across the neighborhoods. Now it's a source of great anxiety. It rained yesterday and the day before, and the first thing I do is look in my basement or see if it's pooling in the streets, right? So it's really affecting public health. And then we realized that people had solutions in these neighborhoods, right? They were able to identify what the real issues were, talking about infrastructure in the city and how these issues were addressed. And so at the household level, at the community level, people working on rain gardens, people working on disconnect downspouts, looking at getting sump pumps, but they had some very specific suggestions for federal and state government too, right? And so this woman said, there's really no plan in place, so be prepared, help your children, and pray. We hear a lot of stories about how FEMA doesn't really apply in these recurrent situations. And so if you had an extreme event, you may get denied, you may have to pay up front, you have to document it. And so you're kind of left living with these really unsanitary conditions that can cause all sorts of havoc. But there's a lot happening. It's exciting times in Detroit's 139 square miles. And so we hope that we can thread in some of these stories, right? The Detroiters Working for Environmental Justice just put forth a climate action plan. The State Health Department is working on climate and health initiatives with local cities. The Green Task Force has a water agenda. And this is a reference to some work that I've been doing with my partners in Ann Arbor and at Wayne State to build bioretention gardens. You can watch the PBS clip of this documentary that covers it, that talks about how this garden can capture 200 to 300,000 gallons of stormwater, right? So there's some solutions. So final thoughts here. We want to remind decision makers that, as we learned in Flint, infrastructure is a public health issue. It's a public health solution and problem, right? Climate change is the great multiplier. It's one of our most pressing issues, whether or not we want to accept it. And we think that these issues are the ones that need to be risen up and told to decision makers. As Detroit is rebuilt, revitalized, reimagined, right? All these great words by decision makers, we want to draw attention to the narratives of residents in these neighborhoods who have some of the solutions. That's all the time I've got. Thank you.